And it's also allowed us to do guided bone regeneration, which is when there's not enough bone for dental implants. And the term is either guided bone regeneration or ridge augmentation to make the bone wider. That's a surgical procedure. And I'm able to utilize tissue substitute of bone allograft, the growth factor. I can do it with an absorbable membrane, which takes away some of the infection risks or major complication risks with non-absorbable materials or titanium mesh. And we're able to do those in a predictable way. The next side is guided dental implant surgery, which also goes back 20 years. My first cases of that were 2004. One of the big differences, up until 3 years ago, I needed a lab to do segmentation of the scan for me to give me solid files that I could see where there was bone, where there was teeth. And it was a human doing that, so it was not extremely accurate. If you looked at a tooth root after segmentation, it didn't look like a tooth root. It was very fuzzy and mal-shaped around it. And the second thing is, if I wanted a surgical guide made, it took 2 weeks to get it back. Today, I could see you this afternoon. I've had patients come in the morning, send them out to lunch, and have them come back at 3 o'clock and have the surgical guide ready for the surgery, because it only takes about 15 minutes to do the surgical planning and about 30, 40 minutes to print the guide. So it's a huge change in how we can manage the process of the care.